What is public health, and why does it matter to all of us? If you think about public health as an image of hospitals and doctors, that is only one part. It affects individuals, families, communities, and entire populations. At Edusanitas, we explain healthcare concepts in clear, simple language. Public health is something that belongs to everyone, while health belongs to the individual. In reality, the two are deeply connected. Public health focuses on what is good for the general population, but its goal is to influence change habits, raise awareness, analyze trends, and use data to improve how people live and stay healthy. Through education, prevention, and public campaigns, public health tries to shape outcomes not just for one person, but for many lives at once. Public health and society. Public health is closely connected to politics, history, and even the way we see life. It often starts with one case, one person, then a few more, then dozens, then hundreds, thousands, and eventually millions. Those points begin to connect, forming patterns. And those patterns help us understand what is happening in society. But not everyone is connected equally. Some people have access to care, information, and resources. Others do not. That is where gaps appear, and public health must reach those who are left behind. One of the biggest challenges in public health is the distance between individual needs and population needs. We can think of this as individualization and generalization. Public health often makes recommendations based on general results, what works for most people, most of the time. But assuming the same result for everyone is like imagining a perfect world. And public health, as a science, reminds us that perfection is beyond our reach, not because it lacks accuracy, but because there is always a way to improve and develop, explore, and find. A practical example: exercise 30 minutes a day. This sounds simple, but what happens inside a real household? One person may be obese, another may be bedbound, another may be overwhelmed caring for everyone else. Telling all of them to exercise without evaluation is to ignore their reality. Public health intentions are good, but individuality always matters. What is public health? One widely recognized definition comes from the Institute of Medicine that in 1988, in the Future of Public Health report, defined public health as fulfilling society's interest in assuring the conditions in which people can be healthy. That phrase, assuring the conditions, is powerful. It tells us that public health is not just about advice, it is about creating environments where health is possible. Patterns, needs, and equity. Public health looks at collective experiences. From these experiences, patterns emerge. From patterns, we identify needs. It is a galaxy of individuals linked by the need for fair, equitable, and compassionate care. The goal is to improve outcomes over time, while always considering the well-being of the entire population. Empathy in public health. Public health must always include empathy. Without empathy, populations become numbers. Budgets are weighed against lives. Resources are allocated without understanding real human needs. Public health loses its purpose if it becomes detached. At the same time, public health would not exist if everyone's needs were completely disconnected, or if everyone were exactly the same. The balance is in recognizing difference and connection. Communicating health wisely. Sharing health information must be done carefully. Saying 30 minutes of walking is healthy may not help, as we saw in the previous example. Saying clean water is a basic need may not help someone already suffering from contaminated water. Public health communication must meet people where they are, acting as a bridge. Communities benefit from public health through safe environments. Overall population. At the population level, public health uses data to understand health trends. This helps governments and organizations prevent outbreaks, plan services, and reduce health inequalities. In conclusion, public health means shared responsibility. Prevention, education, protection, systems, not just individuals. Nutrition information, prenatal care, childhood immunizations, home safety education, clean water, waste management, community clinics, health outreach programs, disease surveillance, policy decisions, emergency preparedness. Health is interconnected. Prevention is proactive, not reactive. Equity matters, and much more. At Edusanitas LLC, we focus on healthcare education and ESOL-friendly topics. If you want to learn more about healthcare basics, subscribe here on YouTube. See you next time.